So welcome to our European Digital Health Policy panel at this year's Conv2X Symposium. Digital transformation of healthcare and data-driven medicine are becoming increasingly important for many societies and their economies. Governments are trying through policies and regulation to balance interests, to create the environment for business to succeed, but also to protect citizens' privacy and strengthen trust. Let's have a look at Europe, with its 500 million citizens and one of the largest single markets in the world. How do Europeans feel about health data sharing? What are their governments? What is the European Commission doing to ensure that their citizens and economies get the most out of the digital health era? My name is Micaela Monteiro. I'm a physician and I've been working in the digital health space for about 10 years. I'm presently working in Lisbon as a Chief Medical Officer for Digital Transformation at Portugal's largest private healthcare provider, CUF. And it is my pleasure to host this exciting panel. And I'm absolutely thrilled to welcome three amazing speakers that are highly respected experts and leaders in the European digital health space. We will hear about the European health data space, what is it and what can be expected from it. They will share with us very interesting insights about to which extent European citizens are willing to share their data and what are important factors in gaining their trust. And we will learn about Germany's efforts to leverage digital health through the German Digital Healthcare Act. So now I welcome Saara Malkamaki from Finland, Dipak Kalra from the UK, and Stephan Schug from Germany. I would now kindly invite our speakers to introduce themselves to our audience. So Saara, ladies first, would you like to start?
Sure, thank you so much, Micaela, and lovely to meet you all. My name is Saara Malkamaki and I work in Sitra, which is the Finnish Innovation Fund. It's a public think, do and connect tank that always looks 30-40 years ahead and plans the future for Finland. And there I'm really working on this fair data economy and promoting the use of health data in Finland and in Europe. And the project I work for at the moment is Health Data 2030. And I've been actually working with health data for the past 5 years, and that is my expertise. I really love the health data ecosystems and business models, and I think that's shortly about me.
Thank you, Saara. Thank you. Dipak, would you like to?
Yes, thank you very much, Micaela. Hello, I'm Dipak Kalra, and I'm the president of the European Institute for Innovation Through Health Data, which is a not-for-profit, multi-stakeholder organization in Europe that helps to promote better value from health data for all. My own personal background is I was a family doctor in my early career and migrated through a rather strange love affair with health information into academia, and I've spent over 25 years in electronic health records research, working mostly at a European but also at an international level. And then 5 years ago, we created this institute so I can continue to have a great deal of fun on the health data topic.
Thank you very much, Dipak. Stephan.
Yes, my name is Stephan Schug. I'm the president and acting board member of the German eHealth Association, DGG. And I've similar as Dipak, now roughly 25 years background in digital health, both on a German but also on a European level, 20 years as Chief Medical Officer of eHealth, and also with an international dimension, since I have some links, for instance, to HIMSS for quite a while. What I will report you today relates mostly to my work with many policymakers in Germany, where I have been for many years the coordinator or secretary of a working group jointly run by the Federal Health Ministry and the states, the German Länder, which do the German legislation and also the funding of the German healthcare system. And this is what I will report to you later.
Thank you very much. We are really curious about what we are going to learn with you. So let's start then. Dipak, would you like to share with us your knowledge about the European health data space, please.
Well, that's very kind of you. Thank you very much, Micaela. I'm going to just share my screen and then hopefully you'll be able to see my slides. I'm going to tell you about the European health data space, and in particular, the topics that I've been involved in working with many colleagues, which will start off actually by explaining the health data as a concept in Europe, how we see it, and then I'll move on to this thing called the European health data space, which not all of our audience may know about. But let's just start that collectively, we are now very ambitious about how we want to use health data. If we think about the individual level, the individual patient, or perhaps the healthy citizen, we have a lot of areas in which we want to take advantage of health data, whether it's to monitor the status of a person, to ensure they have good continuity of care, that we can track care pathways and clinical workflows, but be more active and give real-time feedback to clinicians and to patients. We want to practice personalized and preventive medicine, all using health data in ways in which we've not up to now done so, using clinical decision support and artificial intelligence as the latest areas of innovation. But we also want to reuse this data at population level, not only to look at things like how healthcare providers are performing, but to look at quality and safety of care, to optimize our care pathways on the basis of real-world evidence, to improve algorithms, to look at safety monitoring and also public health issues and topics. Of course, at the moment, really in our minds, COVID-19 and how we're using population level intelligence for planning and sometimes for more sort of urgent interventions. And then on a big data landscape, often across borders, using big scale data, we want to learn more about disease course and treatment. We want to innovate in the medical device sector, in the medicine sector. Of course, development of AI needs big data. Personalized medicine and biomarkers do. Drug development, disease understanding, and so on. So our ambitions are huge. And if we look especially at the right-hand side of this slide, the question is, how can we scale up data access in order to achieve these objectives now in a faster and cost-effective way? Right across Europe, there is massive investment in infrastructures to try and achieve that. And on this slide, you see a scattering of logos and icons. They may not be familiar with all of you in the audience, but I just want you to feel that in Europe, it's a really busy space. Countries are investing in infrastructures, and there are projects at a European level investing in infrastructures, whether it's near to life sciences type infrastructures like Elixir and the Open Science Cloud, or whether it's near to clinical data side and observational data like EMF and Eden. All of those areas are actively building environments to allow big scale data. The commonest architectural approach to achieving this is known as a federated architecture. It's where the data are living in their own locations and we analyze them remotely. I've taken the following slide from one of those infrastructure programs called Eden, and it's a nice slide because I think it's actually very clear. If you look on the left, you see an imaginary hospital or a healthcare organization, or it could be a registry that has in green all of its own data ecosystem. And in the middle of that, you drop a blue rectangle called a local data warehouse, where you map the data from its local environment into a common data model. And you connect that and others to a central platform where the researchers are able to execute a research query. The query is sent by the platform to each of those data warehouses, where there is a processor that will run the query and just return the result set back to the platform, which consolidates the data and sends it back to the researcher. The great benefits of these architectures is that the data remains local at source. The fine-grained patient-level data is under the control of the green zone, not the blue zone. They can choose what they share, they can choose what they make available, and they can change their mind later if they wish to. It's much easier to implement good practices in data protection using this kind of architecture, which makes it very popular in Europe. Now, the European Commission, building on all of that activity, is now proposing something even grander at a European scale. And it's called European Data Space. And although today we are talking about health, in fact, there are plans at the European level for a data space in other sectors like transport and agriculture and manufacturing. But I confess we are excited by the health one, so I'm going to stick to that topic and say that we are excited by the innovative ideas of the Commission to pull together a networked environment in which data can be scaled up at a European level. Now, it's still on the drawing board, it's still in active consultation, so there is no actual definitive diagram, but what I'm showing you, which we've developed with colleagues in a project I've been part of called Digital Health Europe, is a concept model where you have something, a common European health data space, and then you connect into that, you plug into that some of those federated architectures that I've described, things that are already moving patient summaries across Europe, an area of growth of the European medicines regulators. Rare diseases have a platform at a European level, so that can plug in life sciences architectures, but also some of the national eHealth infrastructures and research infrastructures might be able to connect into this and create a common environment with perhaps a common access portal. So these federated networks then can support continuity of care, they can support the regulatory environment, such as safety monitoring, and also new research. And then there are actors who today do not normally have their own federated architectures who can connect into this and become users of it, but they might also contribute their own data. We know from speaking, for example, to the pharma industry and the medtech sector, they're interested in being givers and receivers, bidirectional data relationships with the European health data space. And that's the exciting vision that has captivated so many people in Europe. Now, this will only succeed if we have harmonized data governance, if the rules of engagement, the rules of access are harmonized, if there is interoperability, if there is trustworthy data quality, and of course, there is work to be done on building infrastructure building blocks that will act as connectors to these different networks. And that is the exciting European vision that I need you to understand, and I hope to also be excited about. Now, when we've undertaken over the last 12, 18 months, multi-stakeholder consultations about this vision and said, well, what are the success factors? What will make this succeed? We've ended up with 7 topics that people have said need investment, need focus. And the first one, the universal one, is we need to raise the digital literacy. And I think I would add to that now the data literacy of all stakeholders. Of course, patients and citizens need to buy into this vision. They've got to understand what's happening, but many health professionals need to understand the value of the data they're creating, etc. We need to see the value of real-world evidence being raised and understood by all of the stakeholders in the game, because we need to increase ICT investments. We need to look after the culture of data creation and data reuse. We must have better interoperability. It is still today a poor level of adoption of the standards that we've all been part of making, but actually are still not out there on the streets making data fly between systems, and we need that to happen. We've got to show to society how the data are beneficial, how using data delivers societal value through better care, safer care, innovations, through public and private organizations. That's a landscape we've got to sell. Now, I'm not going to go to all of these points, but what you do understand is that there are critical success factors. We're working on them. We're onto it. Now, what about people? patients and citizens, healthy citizens and patients, when you speak to them, and we've done this in focus groups about the European health data space and the opportunity, what do they say? Well, what they actually make clear, forget about the vertical bars, just look at the axis. They want more access to data so they can manage their own condition, track their state of wellness and fitness. They want to use their health data as a tool to view personalized medical information. Don't show me stuff that's not relevant to me. Use my record to show me things that are relevant to me to know. I want to learn more about conditions. People would actually like to connect with other patients who are very similar to them. What does very similar mean? It means you look at the EHR, you look at the EHR of others, and you matchmake people into communities with similar disease profiles so that they can actually share meaningfully and usefully. People want to use their data so they can talk more meaningfully and constructively to their professionals and have engaged conversations and be more empowered. That's actually a really exciting vision if you think about it. And that is what we are seeing, and that's what's starting to be stimulated in Europe. But I do want to end a little bit more on a cautious note, if you don't mind, because as we go on this slide, we've also got to be proactive in tackling some important challenges. Because when you go from left to right on this slide, the public understand less about why and how their data are being used. The users are less familiar actors to them, people they don't think of as being players in the data space. The results are not necessarily very close to the patient themselves personally, and it takes time for those results to materialize. So the distance between when the data are accessed and when something of benefit arises can sometimes be years. And people don't always feel they have much choice as you go from left to right on this slide. So we've got to, and this is now my last slide, Micaela, we've got to just say, how do we reach a point of societal acceptability to this? Because we have in Europe, as I hope many of you know, very stringent data protection regulations that we don't resent. We do celebrate those, but we have to live with the consequences of those as well. We also know that clinical research brings benefits and that many patients are in favor of the outcomes, the benefits that come from data. But the trouble is, we also know that the hype about our general data protection regulation creates a climate of fear in the public sometimes, among data protection officers and chief executives sometimes. And we've got to resolve that by having greater transparency about how we use data, how we safeguard data, and what those benefits are. And so I feel, Micaela, the challenge that might come up in our panel discussion is, how do we find that balance between the rights of individuals and the benefits of society? We want both. Can we get both? Thank you very much.
That's the $100,000 question. So thank you very much, Dipak. So we are going to discuss this a little bit further later on. So Saara, please share with us your insights about how do Europeans feel about sharing their data? What does frighten them, and what helps to create trust? Saara, please go ahead.
Happy to do that. So actually what Micaela already told you that I'm going to talk about is the European willingness to share their data and what do they really expect in return. So there's always the sharing of data and expecting something in return. And I'm going to show you results from a Wearables survey Sitra conducted last year, and also touch upon another survey that studied Europeans' attitudes towards the use of personal data. Okay, let's get going. So, why do we want to talk about citizens' willingness to share their data? We quite often really focus the discussion on the registry data and less focus on the personal data, my data, so to call. So let me start by showing this slide, which demonstrates well who creates data in the future. While data from the professionals and systems is growing there and growing all the time, data from the individuals, which is the green line, is growing exponentially. So in the future, our personal data will have a tremendous impact in our health and healthcare, and even more than we think at the moment. So how is the adoption of wearables among Europeans? As I told you, Sitra studied the use of these smart devices and self-measurement, as well as people's attitudes towards the data produced by these devices in a wearable survey, which was conducted in 4 European countries, so Finland, Netherlands, Germany, and France, and that was done last year in the summer, and more than 4,000 respondents took part in it, which meant about 1,000 from each country. So half of these respondents currently used different kinds of activity tracking devices. That's, I think, fairly quite a lot. And the solutions used most for measurements are applications included on our smartphones. So 38% mentioned those. Also, activity trackers and smartwatches were used and were quite popular, and some other smart devices and smart rings as well. But smart rings were only with 4%, so more on the activity tracker side and smartwatches side. And the use of these devices has really increased, especially during the past 2 years, and measurement is further increasing. So it's getting really popular, and almost 1/5 of the respondents really started just using these devices in the last 6 months prior to this survey. So it's really upcoming, so to call. And what do people then most commonly measure with these smart devices? You can see here that the number of steps is clearly the most popular measurement. So 2 out of 3 respondents from Europe said that they count their steps with these devices. And of course, the calories and heart rate were also mentioned, and by approximately half of the respondent. Sleep and weight by more than 1/3, so it's getting a little less. But when we think about these results, these are all well-being measurements. We also asked, like, if you measure associated with the medical conditions, such as blood pressure or blood glucose, but those were measured much less commonly. So just keep in mind that the well-being measurement is really up and going. And for many of the respondents, the use of this measurement resource was already part of their everyday life. So nearly half of them really reported that they can make use of the data they measure every day or nearly every day. So they use it very actively in their lives. And 1/3 of them said that they use it a few times per month, and only 5% said that they don't make use of it at all. So they don't use the results. So I think it's really encouraging that people use the results. And in my next slides, you can see even more interesting results, because those who currently measure their well-being data feel that the data is very useful for them. Here you can see that a total of 40% of the respondents said that they had really become motivated to do more exercise. 19% had adopted healthier eating habits, and 19% took more responsibility for their own well-being. And also 17% learned to listen to their body well. So if we just stop for a second, I think these results are actually quite amazing. And it shows that the well-being data measurement has enormous potential to prevent diseases in the future. So, are Europeans willing to share their data, and with whom then? So more than half of the respondents would share their data with their own doctor or nurse, or show it to them, of course. And 43% would be prepared to share their data with research organizations if it were directly or indirectly beneficial for them or others or anybody else, basically. The number is, of course, diminishing a bit when we go further. So pharmacists was 40%, and personal trainers 37%, and healthcare service companies only 25%, so going to the red. But what really struck here is that only 18% of the respondents from these 4 European countries would be prepared to disclose their data to insurance companies and pharmaceutical companies. So this is something that maybe we discuss later in the panel, how this balance is where citizens want to really share their data. And I also mentioned that we also had to think, what do people expect in return? And it's clear to say that some kind of value, always some kind of value needs to be provided back to the people who provide the data. And in this study, we can see that the motivation for using smart devices and for self-measurement would really increase a lot by strong privacy protection. So 68% mentioned that, and people also really value that the services are easy to use or start using, and they can get access to their own data. So this is something as you can consider giving value back. So those things were mentioned in the survey. So here I have actually brought results from another survey that I mentioned Sitra did a couple of years ago, and this survey studied European attitudes towards the use of personal data in the same 4 countries than I mentioned before the Wearables survey did. So the same 4 countries, but in this survey, more than 8,000 respondents took part, so the double amount, and from 2,000 from each country. So from these results, you can see that 8% of the people would be really willing to provide access to their health or genetics data if they were offered extra services or individual service. That is, the value would be given back. 12% if the data would be used for public interest purposes, for example, healthcare. 14% if they were paid for it. 23% if the information would be used for scientific research. That's quite a low number, but actually Finns were here a bit of an exception. So 38% would give their data for scientific research, so that's very popular in Finland. So, but overall 20% in Europe, and 30% of the people were not willing to provide or allow access under any conditions when we did this survey. So in the same survey, we really asked also if a lack of trust in service providers prevents people from using digital services. And here are the results. So in average, 40% of people strongly agreed on it. Here the Germans were most suspicious with 48%, and the lack of trust were actually highest among managers, senior salaried employees, and between the 25 to 45-year-olds. And this just really shows that the lack of trust is a big problem, and this is something we need to discuss today as well. So what can we learn from the results? First of all, well-being data measurement has an enormous potential to really prevent diseases. Trust is a must. That's my second point. So building and maintaining trust is really essential, and we need to base our business and new innovations on trust and build services in a fair and transparent, user-friendly way. And here you may ask now, how can we do that? So, well, there's of course many ways, but what we got out of another survey we did, the use of digital service results, were 5 important factors which increase trust towards service providers. And those were, at least first, the service informs clearly how my data is going to be used. The terms and conditions are clear and quickly absorbed. That helps. Of course, people want to delete all their personal data if they want. So the service provider has the information, though they need to be able to delete it if they want it. They want that they can accept or decline the selling of their data to a third party. And if they get clarification of what information the service provider has about them, that also helps to build this trust. And we also asked that people thought that a similar label such as fair trade is very familiar to us, a fair trade coffee or something like that. You have a label in the bucket and you see that it's a fair trade. such similar thing like fair data label could be a great addition here. And my last point here is that in future healthcare, more data is really generated by individuals outside of the healthcare systems. So let's take that into consideration when we talk about building health systems and healthcare and our health in the future. And here our vision really is that the future healthcare is person-centered and data-driven. My data, my personal data, is part of the healthcare system, the decision-making process. A person becomes really an active co-architect of the health and new digital services. So integrate that in there. And every person has this full transparency over what happens to his or her data. That's it. Rise to shine. Thank you.
Thank you. Thank you very much, Saara. I really liked trust is a must. So, so let's go ahead so that we have a little more time some time to discuss at the end, because time is running. So, Stephan, could you please share with us what's happening in Germany?
Good. Just stealing the screen from Saara, but it seems to
Please
work.
do.
Okay. So I gave my piece now the title Digital Health Boost through legislation in Germany. And I think you have to know that Germany has now since 3.5 years what is called a proactive health minister. And and since we'll face new elections very soon, people, of course, put up those articles doing some violence, what has happened over time. And I've read that he has put forward 40 laws or 40 pieces of regulation in these years. So something is happening. So that's why I used the word boost. So let's now go to it. And so where does Germany stand? It's not on the slide, but there's looking from Europe. There are these European comparisons, and Germany actually has a tradition to rank as one of the worst adopter of digitization in healthcare. And but it's changing now. So what I put here under assets lists what's there, which may not be fully connected, but which are the building blocks that can be used to build a connected healthcare system. So we have already quite a bit of digital hospital EHRs, and a lot has been done to digitize older paper records. Digital imaging is a must. We have reimbursement procedures in place, digital and telehealth, of course, now through COVID, but is relatively easy to use and is in use. But we have as barriers that there's a lack of integration, particularly between healthcare sectors, but also between information systems. We do not have lifelong EHRs. We have a lack of data-driven care, so what Dipak has explained to us. And also apps and mHealth are not very well established with a link to the healthcare system. And there's something in the German healthcare system you have to understand. Maybe it's not too dissimilar to the US. The specialist care is dominated by office-based specialists, and many also of those practices work single-handed and are not necessarily networked. So on a high level, our digitization initiatives, where do they go? So as I said, the ambulatory sector needs to be connected, so we have a secure network being rolled out, and it's now mostly complete, spanning ambulatory care, hospitals, and pharmacies. It's a highly secure infrastructure based on hardware connectors, at least so far. Migration strategy is on the way. We see currently now the service rolled out for emergency data management, medication plans, secure email, and finally, even faxes will disappear from the health system, and they are not legal anyhow. And so our newest pieces will be an EHR will I demonstrate in more detail, a secure messenger based on the interoperable matrix protocol, then digital therapeutics called TEHDAS in Germany, digital nursing apps, the Dipak, and a lot of measures in enabling secondary data use. So that's the starting point and what's going to happen. So my focus here is on the legislation. So let's look at these 7 pieces of legislation here, which define the roadmap. The main title was given with the Digital Healthcare Act, and it's from the end of 2019. It has been prepared by 2 other laws that have been started to build the infrastructure. And this strange legislation here, the Appointment Service and Supply Act, has actually introduced strong disincentives. That means that if people do not comply and install the service, they will have reductions of their funding. So this is the starting point. And now we have, let's say, 3 content elements that will really be built the services. The Digital Healthcare Act has started to define the digital health applications, and so it's supported by the Digital Health Applications Ordinance of April 2020. I will explain in more detail. Then to bring more digital data into the hospital sector, we have now a strong funding program defined in the Hospital Future Act, which is in force since September 2020. And regulations around the electronic health record are in this 2 newer legislations I'm going to explain in a moment. So I do it now in 3 steps. First, we will come to the digital health applications. This is a picture which, of course, looks a little bit complex, but have a look in the center of the page. You see here a traditional paper prescription as it is being used in Germany. So indeed, at the heart of the process, there's a paper-based description, and you could say, okay, doesn't look very digital, but that's just temporary. So the real trick is that there's a process which involves the manufacturer who brings this digital therapeutic application in the market, and it is approved by a process I will come to in a moment, and health insurance is going to pay for it. So the prescription, so it's really prescribed like a drug or something else, is going into the system. A barcode is generated, and this actually...
Sorry, Stephan, we have about 7 minutes left, just to let you know.
Okay, I was afraid I was too slow. This will put the service into action, and so it's worldwide the first service which is a real paid mobile app. So a quick look then at the process. The allowance to the reimbursement system is done through the German Federal Agency for Drugs. There's an application procedure, and the service has to be, or the app has to be medical software of a lower risk group, which means class 1 and 2A in Europe. It has to provide evidence for some positive care effects, and then it will put for 12 months by a preliminary admission into the system. And it has then to prove itself whether it's useful, and after this time there will be price negotiations to find a fair market price. So currently we have 20 apps that have been approved, 15 of them preliminary and 5 permanently already. So just a quick highlighting on what are the principles. Of course, data protection is a must, safety as well. But the interesting and tricky thing is here to prove medical benefits or positive effects on healthcare. So now I jump to the Hospital Future Act, second piece in the system. In this new legislation, there have been 11 domains have been defined that can bring about fruitful pilot projects or implementation projects to constitute digitization in hospitals. Something like a patient portal, healthcare records based on voice recognition, of course, better cybersecurity, telemedicine, closed loop medications, and other. And these have been bundled together as a program, and they will receive significant funding from the German healthcare system. So there are these, and to prove that the funding has been spent well, there will be also a digital maturity assessment. And actually HIMSS is part of a consortium that has been chosen, which is now called Digitalradar, a German. And there will be a verification process where the hospitals to really improve by implementing those new services. So in the end, this assessment will only be part of the story. There will be other assessments, but hospitals could lose 2% of their annual funding. So it may remind you of the Meaningful Use program in the US, where first good things were introduced, but there were also then financial disincentives if it didn't work. So now finding back the way to health data and mobile platforms. The German electronic health record, which has been subject to the newer legislations, it's coming on a mobile platform. So you see here a demo application provided by Gematik, and the data can be integrated.
Stephan, 2 minutes. I'm very sorry. It's always the last one who is very sorry.
It can be integrated into the health records seen by doctors. So there will be a closed loop system. There will be copies of medical findings in this health record, and it can be shared with everyone who is looking for the patient. So you see here the steps that this electronic health record will take. And you see here that in the level 3, in 2023, sharing data for research purposes is part of the plan. And from 2024, there will also be a directly integrated option for supporting cross-border e-services. Now, how can this be meaningful? I mentioned already the Meaningful Use program, and you find something here now which is a little bit inspired because also Meaningful Use in the end builds on semantic interoperability. So here now in Germany, there is a system being established which builds on so-called medical information objects. In German, it's simply MIO. And it has started with simple things like the vaccination pass, maternity pass, or childhood passes. And those are being now defined semantic interoperable objects which are reusable. And this builds the way to sharing the electronic health record data for research. So the last piece I'm going to show to you is now the medical information object, which is built alongside or along the plan, the international standards for the international patient summary. You see this here on the top left. And the international patient summary, which has, of course, also specialty clinical data. It will define the way to including those specialty clinical data into the system of medical information objects, and hence into this electronic health record that can be shared. So in the end, there's a clear strategy now to arrive at meaningful health data, which is under the control of the patient, which helps the patient in his health literacy, and which on the other hand informs everyone involved in the health process to be informed, to share data, and last but not least, to arrive at data-driven medicine. So here I hand back to you, Micaela, and sorry for making it a little bit long.
No, Stephan, thank you very much. And I want to apologize. You didn't make it long. I think this is always when you are the last in such a panel, then you have to cope with the time.
Good.
So yes.
Or I will stop. Otherwise, everyone sees a black screen.
Yeah. So thank you very much. And we have time for one question. And I would ask you kindly if you could give your perspective of it. So we see that this is all very complex. We have a lot of stakeholders. We have harmonization, interoperability, but in the end, it's about people, and it's about patient centricity and citizen centricity. What is your idea about how can we deliver this patient or citizen centricity in digital health and in data sharing? Saara, would you like to just give us a statement?
Well, I think it really starts from putting the patient in the center. As I put up from the questionnaires and all that, it needs to be integrated also in the service design, into getting the data from the patient, what was increasing rapidly, exponentially. So we need that data more in our systems and in well-being services. So really putting the patient in the center. I think that's the most important, and start having the dialogue with them. Wonder why they don't trust, for example, the pharmaceutical companies, or don't want to share data with somebody. Start a dialogue, start to make a difference, because it's important to share the data for the industry as well as research, as the benefit of society. So I think those are a couple of things that I could highlight. Maybe
so give patients
continue.
a voice. So give patients a voice and increase literacy so that they can understand and be active in this process. So Stephan, what do you think about it? What's your ideas about it? How can we deliver patient centricity?
I think there's a lot of truth in this last page, that animated slide that Dipak has shown to us. They said that it's difficult if it's not so obvious for patient and the society what the data is being used for. So, and that's also something which may be in the data that Saara has shown to us, because on this one page, where genetic data came into play, I think there we saw relatively low figures. And I think it's relatively easy. As a person, as a patient, I would only share my genetic data if I know what for. And interestingly enough, I was so honored to help Sitra in giving out a fair data prize for services in healthcare. And the winner was a service on genetic data, because the interesting story was they really offered a clear benefit to the patient, and at the same time they established a very clear process where the patient knew exactly what they shared for what. So I think the patient centricity here has to do a lot with information, or it is linked strongly to having information and seeing for what purpose it is happening.
Right, great. And Dipak, what are your ideas?
Okay, well, both of these two have given you a vision and a way forward. but every stakeholder has got to change. You said, how can we enable? That means the final missing ingredient is a big round table. All of the stakeholders need to come together around the table as equals to agree on how they want to achieve that vision, because every stakeholder has to change the way they work. They've got to work more smartly, more collaboratively. You put the patient in the center by everybody changing, not just changing the patient. So the round table is the secret ingredient.
Yeah, thank you very much. Collaboration. So thank you very much. We still have a long way to find the right and fair balance between the interests of society as a whole, the individual, the economy, when it comes to digital health, and in particular the use of health data. So I think this panel gave an important input to this discussion, and I'm really grateful. Thank you very, very much to our speakers, Saara, Stephan, Dipak, and many thanks to our audience.